Good morning, I am Anslin, nursing tutor from Emmanuel Arasar College of Nursing. Now we are going to see about hypoparathyroidism. The parathyroid glands release a chemical hormone called parathyroid hormone. This hormone helps to control the levels of two salts in the body, calcium and phosphorus. There are four parathyroid glands, each the size of a grain of rice, in your neck behind the thyroid gland. They produce parathyroid hormone which helps control the level of calcium, phosphorus and vitamin D within the bones and blood. Normal level of serum calcium is 9 to 10.5 mg/dl. Normal level of phosphorus is 2.5 to 4.5 mg/dl. Definition of hypoparathyroidism is it occurs due to hyposecretion of PTH by parathyroid gland characterized by decreased calcium level and hyperphosphatemia. Types. Acquired hypoparathyroidism is a condition that develops when your child's thyroid gland makes little or no thyroid hormone. Thyroid hormone helps control body temperature, heart rate and how your child gains or loses weight. Thyroid hormones plays an important role in normal growth and development of children. Transient hypoparathyroidism. It occurs most commonly in babies who are born too soon. Congenital hypoparathyroidism. The parathyroid glands do not develop properly while the baby is growing in the womb. Inherited hypoparathyroidism caused by an inherited problem caused by chemical called antibiotics attacking the parathyroid gland. This is called an autoimmune illness. Etiology. Tumor of thyroid gland. It can occur following thyroidectomy because of removal of parathyroid tissue, accidental removal of parathyroid gland, idiopathic causes, inadequate secretion of PTH, increased reabsorption of calcium in GI tract, phosphate excretion by the kidney decreases. Pathophysiology. Due to the etiological causes, it leads to decrease in gland function, which leads to resistance to PTH action, which leads to inadequate PTH secretion and increased reabsorption of calcium in GI tract, which leads to blood calcium fall to low level, which results in muscular hyperirritability, which leads to uncontrolled spasm, hypocalcemic tetany. Clinical manifestation. Hypocalcemia and hyperphosphatemia, dry hair, rough pale skin, hair loss, cold intolerance. Due to hypocalcemia, there is sign of tetany, carpopedal spasm, bronchospasm, laryngospasm, visual disturbance, seizure. Numbness and tingling in the face, muscle cramps and cramps in the abdomen or in the extremities. Dysphagia, photophobia, cardiac dysarrhythmias, convulsion. Then positive Trausi sign. When we inflate the BP cuff on arm, inflate above systolic, there is spasm, contraction of finger of that arm. Positive Chustock sign. Contraction of facial muscle when light tapping of facial nerve in front of the ear. Diagnostic evaluation, history collection, lab studies, physical examination to check PTH level. Medical management, monitor vital signs, administer calcium gluconate or calcium chloride for hypocalcemia. If calcium gluconate does not decreases neuromuscular irritability, administer sedative, vitamin D, administer phosphate binder. Parenteral parathrombin can be administered to treat acute hypothyroidism. Aluminum hydroxide is administered after the meal to bind phosphate and to promote excretion of phosphate from GI tract. Surgical management, tracheostomy or mechanical ventilation may be necessary along with bronchodilating medication if patient develops respiratory distress. Hormonal replacement therapy, advised high calcium, vitamin D, low phosphate diet. Instruct the client to wear medical alert bracelet. Complication, acute airway obstruction, CV failure, mental disorder, subcapsular cataract, shortening of finger and toes, below normal temperature, decreased breathing, low blood pressure, low blood sugar, unresponsiveness. Nursing diagnosis: activity intolerance related to weakness and apathy, less than body requirement calcium level related to inadequate calcium diet or intake, risk for ineffective airway clearance related to laryngospasm. Thank you.